Hey, talking about a common self-mobilization technique, a good technique to enhance mobility in the tissue, get the blood flowing in the tissue, maybe work out some of those adhesions, restrictions, even scar tissue. We're talking about the old foam roller. A couple tips on this one. Everyone's got their take on foam rollers. Are they good? Are they bad? The different techniques. Should you do it? Should you not? I find it to be, obviously, like everything else, individualized. It might work for you. It might not work for you. And that depends on body type, what you're trying to actually address with it, and beyond. It always comes in dose dependent as well. You don't want to overdo it with the roller. I have so many patients that come in sometimes and they're like, man, this thing was bugging me. I couldn't get in to see you, so I just rolled the heck out of it 3 times a day for 3 days in a row waiting to come in. That's too much. That's too much. Essentially, when you're doing the roller, you're really using body weight unless you have some strength to pull yourself off and calibrate how much pressure you're putting against the roller, which is serving like someone applying a manually deep tissue therapy to it. So you wouldn't get a deep tissue massage 3 times a day, 3 days in a row. So if an area is hurting to begin with, you may not want to mash it out 3 times a day for 3 days in a row either. That's too much. That's too much breakdown, not enough buildup, not enough rest recovery. And a lot of the times, depending on what's going on, sometimes you don't even want to roll some of these injuries. You might want to roll around it, mobilize the tissue around it, but you might not want to roll that injury directly or that discomfort directly, if that makes sense. A couple takes on rolling, though. These will be just basic 3 ones right here that I like to implement personally and help patients along with. Number 1 has nothing to do with rolling. It actually is the preview, the pretense to rolling. You want to make sure you're hydrated. So many people are not hydrated. You want to make sure you're hydrated before you get on that roller. In order to mobilize that tissue, in order to have that tissue be responsive and robust, you want to make sure it's hydrated. So definitely stay hydrated throughout the day. Before I get on the roller, I definitely like to at least make sure I get about a liter, half liter of water in beforehand. The other aspect of that is that's just one part of the equation. You want to make sure that water, some of the water you're drinking, has electrolytes in it. One of the companies I've been using a lot lately has been from this one right here, Trace Minerals. This is their magnesium supplement. Makes it real easy. You just unscrew this, put some drops in your water, whatever thing you drink your water with. My first one of the day, every morning, I make sure I put 5 drops in there. And I don't use this one. The one I actually use from this company is called Keto Electrolyte Formula. Don't get hung up on the keto. It's probably a trendy that they threw keto in there to get people on it. It has a nice mix of electrolytes in there, your sodium, your chloride, your magnesium. What else we got in here? Potassium, sulfate, even boron in there as well. And it has a different dose, different levels. This one is more heavy in the magnesium side. I like to use this sometimes too, just for another side of magnesium, intracellular magnesium, but that's a side note. So you want to try to make sure you're using an electrolyte formula, at least that first one of the day. When we sleep at night, we're losing a lot of water, and we're losing our electrolytes as well. So you don't want to just flood it out with water. That's just going to perpetuate further dehydration. Water's going to flow right through you. It's not going to hydrate the tissues adequately. You want to make sure you're getting some electrolytes in there as well. I'll usually do 1 liter with, 1 liter without, 1 liter with, 1 liter without, especially if you're drinking some of that good water, some of that RO water. Reverse osmosis, one of the knocks on that is that it strips everything out of the water, even the beneficial natural minerals and elements in there. This is one way to start putting it back, to make sure you're properly hydrated and you're replenishing those electrolytes. So that's one aspect of getting at your foam roller. Make sure you stay hydrated, and especially if you can, make sure you put down that liter. Put down a liter with some electrolytes in it before you get rolling. Your body will respond to the foam roller that much better. Stay tuned, we got more tips coming up.